Tonight on your 5 News at 6, a River Valley man is indicted following an FBI investigation for healthcare fraud worth $100 million. The latest on the investigation in just a few minutes. First, though, children ages 5 to 11 are now eligible to get a pediatric dose of the Pfizer COVID-19 vaccine. And this announcement has left many people in the natural state wondering when and where their child can get the shot. Thanks for joining us for your 5 News at 6. I'm Erica Thomas. 5 News reporter Catherine Gilker joins us in studio to begin our team coverage and tells us what parents need to know. Catherine?
Erica, even though one of the COVID-19 vaccines has been approved for 5 to 11-year-olds, there isn't anywhere to get your child a shot here in our area just yet, but it's likely the shot will be readily available by the beginning of next week.
We are on the brink of vaccinating our 5 to 11-year-olds, and that means we're going to have kids that are fully vaccinated in time for the holidays.
The Washington County Health Department has pediatric doses of the COVID-19 vaccine, and they will be sending those doses to local pharmacies and clinics that are part of the Vaccines for Children program. Pediatrician Dr. Marty Sharkey with the Fayetteville Board of Health says pharmacies and clinics will start giving the shots at different times because this is a process.
Because this vaccine we have to retrain on. It is diluted differently, it is stored differently, it's a different dosage. So we have to make sure that everybody's on the same page as far as all those metrics go before we start actually putting doses in arms.
Big chain store pharmacies will be receiving their doses from the federal government as well as community clinics that are federally subsidized. Dr. Sharkey says those big chains are supposed to be getting their doses at the end of the week.
I really do expect that by the first of next week, it's going to be widely available throughout the county. Just the next few days, it's going to be a little bit of a game of an opposite of whack-a-mole. Where's it going to pop up first?
The Fayetteville School District is already planning vaccine clinics at elementary and middle schools for those students who are now eligible. District spokesman Alan Wilborn says parents will be getting emails this week with more information. He says getting more students vaccinated will help to lower their quarantine numbers.
If you are fully vaccinated and you come in contact with or exposed to a person who is positive and you're fully vaccinated, you don't have to quarantine. And that's huge in terms of keeping kids in school.
We've actually learned that some of the first pediatric doses were given at the Washington County Health Department earlier this afternoon. Pediatrician's office will be the first to get doses, but first you'll also find that pediatric doses mainly in the same places that were offered the other doses, with an addition to the Arkansas Children's Northwest. It's recommended that parents first check their pediatrician's website before calling. Back to you.
All right, Catherine, thanks. Now, when the pediatric dose of the Pfizer vaccine is available in Arkansas, you'll need to call your pharmacy or local retail store pharmacy to check on availability. 5 News reporter Zoe Henry continues our team coverage from the newsroom and breaks down the difference between this vaccine and the one that's been available throughout the year. Zoe?
Erica, there are vast differences between this dose and the other. This one, it's a modified version for the children, and adults get a larger version, but both doses aim to do the same thing. There are significant differences between the newly approved pediatric dose and original dose. First, color. The new dose will come in an orange vial instead of purple. Next, the dosage. The pediatric dose is only a portion of what adults would typically receive when getting a vaccine. And this one lasts longer, up to 10 weeks, which will help with reducing waste.
The formulation for the pediatric vaccine is different than the formulation for the kids who are 12 and older.
The state of Arkansas is expecting to receive more than 100,000 vaccines in total.
There's about 271 or 72,000 kids in 5 through 11. So we'll have plenty of vaccine to get anyone who wants to get vaccinated started with their 2-dose series.
60% of the doses are coming from the state and the other 40% coming from the federal government. But some pharmacies will only be able to rely on the 40% and wait a little longer.
We, as of right now, we're not going to receive any from the state. We're receiving it from the federal, and we expect and hope to get it by the end of this week.
Dr. Dillehay says it's a pivotal step in the right direction.
So getting everyone protected of all ages is going to be very important for us in Arkansas to get on the other side of this pandemic.
Dr. Dillehay says to be patient if you're wanting to get your child vaccinated right away, as they're still trying to distribute the vaccine across the state. Erica.
All right.